We've been talking about this over the last few days, and good old King Charles, actually, is done us fellas a favour, because the announcement that he's going to have an operation to treat an enlarged prostate, something that most men don't like to talk about, prostate, do they? But anyway, it's led to a huge rise in searches for information about the condition.
Yes, they're already calling it the King Charles effect, and it could be a lifesaver. Yeah. One person visited the NHS website's page on prostate enlargement every 5 seconds. One person every 5 seconds on Wednesday after the royal announcement. That's 11 times more than usual.
Let's talk to GP Dr. Laurence Gerlis, who joins us now. Good to see you this morning. What do you make of this, then? Because, I mean, it affects issues with the prostate, whether enlarged or a cancer problem, affects so many men, and yet we still don't like to talk about it.
Yes, men aren't very good at going to the doctor, and they're not very good about talking about their private parts, but I'm delighted that people are taking an interest. I check my PSA level every year, and I advise all of my patients to do that as well. And we do pick up prostate cancers, 6 or 7 a year. The good news is I haven't lost a patient. No one has died of prostate cancer in our practice for a very long time. And it is a manageable cancer, but it does need diagnosing and treating. Now, you also can get a raised PSA just if the gland is enlarged, or indeed if the gland is infected. So the results of a PSA blood test have to be interpreted with some caution. But I'm glad people are taking an interest, and I hope more men get tested.
I know that the Buckingham Palace has gone to the trouble of telling us that it is not cancer. It is an enlarged prostate, and the King is going in for this procedure next week. What's the difference, first of all, between an enlarged prostate and something that may involve cancer? And then what sort of treatment will the King expect to face?
Yeah, that's a good question. Look, we used to do a lot of surgery on enlarged prostates because there weren't medications available. Now there are very good medications that can shrink the size of the gland, that can improve the flow through the urethra. And very few people need this TUR, transurethral resection, which is in effect a rebore of the prostate gland. Now, I'm interested that's what the King is having, and I don't wish to cast any doubt on the statement that's come out. But you can have an enlarged gland without there being a malignant focus within it. He would have had a 3D MRI scan. There are fantastic scans you can have of the gland. Also, a prostate biopsy where 12 needles are put into the gland to look for cancers. So he's had a lot of investigations, and I understand the surgery is going to take place this week. But it's an unfortunate side of getting older. As our testosterone level drops, parts of a man's body change. I don't know if you've noticed, a lot of old men have quite large ears. And I think growth factors cause the prostate gland to swell and then make it harder to pass urine in that way.
You keep talking about the PSA test, which is a blood test. It is not without some criticism, the PSA. And obviously a lot of people still have a physical check. Without going into too much detail...
That's what the men don't want to hear, isn't it?
That's what the men worry about. How do you put our minds at rest over that?
Well, the PSA, as I said before, just because it's increased doesn't necessarily mean cancer or enlargement. The physical examination adds a little bit extra. But nowadays, because of the advance of the 3D MRI scans, that really has taken the place of any physical examination. So you don't have to worry about what one of my patients called the doctor putting on the marigold gloves. A combination of 3D MRI and PSA tests, and there are also urine tests that can be done to pick up factors from a malignant gland. So you shouldn't worry about seeing a doctor and having an invasive examination. There are alternatives to that at the moment.
And if it's already in your family, if there's a man in the family who has had prostate problems, isn't it more likely that any sons or male relatives could be more likely to get something at some stage? And should they be going to their GP now and asking for this PSA test or something?
Exactly, Anne. Certainly there is a genetic factor. It's the same gene that affects certain women, as you will know about that with breast cancer as well. It's the same gene. Also, men of an ethnic minority, particularly Afro-Caribbean men, have a higher incidence of prostate cancer, so they really should be prioritised. But yes, if you have a family history of prostate cancer, you should get checked out.
Okay. Dr. Gerlis, great to see you.
Yeah,
thank you
thank
very
you.
much indeed. And if you are worried, concerned about that, or you just never had a check and you think you should...
You think you should?
Just get on with it. Just get on with it. You've got to grit your teeth and just go and get it done.
Yeah, well, us women have been poked and prodded in various
Well, you
places
have.
for all ways. So, and hopefully it may just come, as Dr. Gerlis said there, just to a PSA test or an MRI scan or something.
Yeah, but even if it doesn't...
Even if it doesn't, yes,
even
it
if
could save
doesn't,
you.
Do you know what? They've seen it all before.
Yeah.
You've just...
And it's nothing.
You just got to get on with it. I mean, it's not a pleasant thought, is it? But you've just got to get on with it.
But don't think about it too much, just go for it.
No, just go.